74% of the folks in the CSP program smoke, and that was a startling number to me, and an obvious kind of need.
The folks that I've seen die from our program have all died related to cigarette smoking issues, whether it be cancer, emphysema, whatever it might be. And so I would feel negligent not providing this for this vulnerable population.
It goes with everything. You know, the drinking and drugging, it's the same thing. I get that program in my head. You can't just kick that program, and the cigarettes kept that going. Oh, it feels great to be tobacco-free. Being able to have where I'm not a prisoner anymore.
I still remember thinking at the very beginning, oh, it's not that bad. You know, it's just cigarettes. And now one of the surprises for me is that I believe that it's just as important, and I don't minimize the negative impact of relapsing on tobacco.
I'm amazed at how much our colleagues have grown, because it used to kind of be this, they're relapsing, what are you going to do about it, that kind of a thing. And now it was, we're in this together.
You have to be committed to doing this, but once it's working, there's nothing. There is absolutely nothing that I would quit. I wouldn't. If they said we're going to start smoking, I would say then you're going to do it on your own. I'm that committed to it, and I think our colleagues are that committed to it. So and not only that, but our patients are committed to it.
For me, I chose this. I mean, I think it's the right way to do it.
There's probably 75% of us down there that were smokers that came in. I thought there would be more people, jonesing, throwing a little fit that they need a cigarette, but everybody's been pulling together.
I was afraid at first that maybe nobody would want to be in it, but we have probably 50, 60 people on the waiting list.
She is a champion of change and a holistic approach for the offenders, and she got the entire treatment facility excited.
Over the years, we've certainly seen that nicotine, tobacco have really been a large issue for the women that we serve here. And we've been lucky that we have Ruby, who is a health educator, and so we have someone that can just focus on the health and wellness of the women that we work with.
So the goal with applying for this WINTIP grant was specifically to try and increase our numbers of people who were calling the quit line and enrolling in First Breath, in addition to trying to foster a new social environment here at the treatment center.
Ruby, actually, was the one who told me about the quit line, and when I found out I was pregnant, I was smoking about half a pack a day at least, and I know that my lungs aren't the greatest now. I've probably, due to blood clots, have lost 30% of my capacity, and now having smoking on that is making it twice as bad. And then I don't want her to have to grow up with smoke in the house, and she needs to be healthy.
It's not about you've been bad. It's not about shaming them. It's about what can you learn from this experience? Because the same process that led you back to smoking is going to be the process that leads you back to drinking or to heroin or to, cocaine. It's that exact same process. So let's use this process that allowed you to go back to smoking cigarettes when you know you shouldn't. And let's apply that to the other drugs of abuse. And you can see that it's the same thing.
I think this program fits really well with an integrated health system operationally, because we have a model here where our behavioral health and case management services are integrated into the everyday practice. And so if a patient comes in to see their primary provider and they are always asked about any addiction issues, nicotine and tobacco as well, and they verbalize that maybe they would like some information about quitting smoking, our behavioral health provider or case manager can go in at the same appointment and give them the education and the counseling options that they need at the time to address it. And that service is an adjunct to the medical visit. So we've kind of taken that cost issue right out off the table.
With a warm handoff approach, where the doctor just calls us up, hey, this person is interested in quitting, can you meet with them briefly now? We talk about a plan, maybe refer them to the quit line, maybe they come back for individual counseling.
The good thing is that we have seen no decline in our census. And I think one of the most significant things that by treatment centers say we can't deal with nicotine and tobacco is that they think that they're going to go out of business. It doesn't happen.
it was a huge culture change. So we're really proud of sticking with it. I think there was probably times when we kind of want to just throw our hands up and just go back to the old way of allowing smoking. But I think when sticking with it, we're really proud that we were able to do that.
When we first presented it, especially to our staff, we got everybody together, we told the staff about what we were hoping to do, and we offered a lot of help to the staff so that they could, tackle their own nicotine addiction. And I can remember being gathered in this circle with people and, arms crossed and really close kind of body language from, not everybody, some of them were clapping, but some of them were really close to it. And now, some of those people who sat there like this are now non-smokers.
I was told about the program, and I was on the committee before it even started. And I decided to try to quit on my own before it even came to Maida House. And I went to the doctor, and for actually 3 months prior to us going smoke-free, I was done smoking.
I didn't care. I didn't care that if it caused lung cancer. I just liked the feeling. But as your mind clear, as you living clean and sober, something tends to click. Like, let me not do this and see how I feel. And it's an amazing feeling, to be able to breathe and to be able to not smell like smoke, and to be able to feel good in the morning, to be able to wake up and not feel all groggy, and so the Maida House staff, they taught us how it will be effective to our recovery.
The information and the staff support that were provided, it was very important, and then certainly Mac, with your training, and then with Chris coming up here, and we trained about 30 individuals from 2 different organizations. It was really very helpful. I know that those individuals really got a lot more information about the different FDA-approved medications that are available, why it's important to certainly assist these individuals, why we kind of have an ethical responsibility, I feel, too, in helping these people, and it's certainly good for our services that we provide in Health and Human Services. It's definitely a gap that I've learned that we need to fill.
I think in the beginning we definitely had a lot of questions, and having WINTIP and CTRI involved and always being there for any kind of questions and checking in on how we're doing and our progress, and always offering support.
Other agencies are going smoke-free now too, so I think it's great.
We would like to see the WINTIP's program go statewide within Wisconsin. She's had conversations with the Office of Program Services out of our central office in Madison, and ideally it would be to help all offenders that want to stop smoking to get that addiction treatment.
I don't know if you've ever heard the term initiative fatigue, where every week, every month, there's something new. There's something new and exciting and interesting that we want to work on. And then sometimes they tend to fade away after time, and you have to have folks like yourself and CTRI and WINTIP who are saying, no, this is really important, and we're going to put our time and energy into it and support others in doing so. And I think without the support, it would not be happening for us.
Good to be a part of that. But on the other hand, it's very sad that it's this late in time when places became non-smoking. In my opinion, what I know now by being a non-smoker and through numerous treatment centers, this was my 6th time through a 30-day treatment, and I relapsed and I kept smoking. They were all smoking facilities. Every one, in my opinion, ought to be a non-smoking facility, because I know firsthand what smoking and my addictions, how they go hand in hand.
And I don't know why people don't. All treatment centers aren't doing this.